Stop what you're doing for 30 seconds and look down at your feet. Because what I'm about to tell you might be the difference between catching a deadly disease early, while your body is still whispering, and finding out 5 years from now, when it's already shouting. Let me tell you about a patient I'll call Walter, 71 years old, retired plumber from Ohio. He walked into my office last spring for his regular cardiology follow-up. He felt fine, no chest pain, no shortness of breath. Energy was decent, and right at the end of the appointment, almost as an afterthought, his wife mentioned that his feet had been a little numb for the past year or so. Walter laughed it off. "It's just age, Doc." But something told me to dig deeper. We ran one extra blood test that afternoon. His fasting glucose came back at 218. His hemoglobin A1C was 9.2. Walter had been a full-blown diabetic for at least 2 years, and he had no idea, because nobody had ever told him what his feet were trying to say. "I'm Dr. Marcus Okoro. I'm a heart surgeon. And I've spent the last 20 years operating on hearts, watching what happens to the bodies of seniors when small problems get missed for too long. Here is the truth that almost nobody outside of medicine ever explains. Diabetes is not really a sugar disease. It is a vascular disease, a disease of your blood vessels. And the vessels that fail first are the ones furthest from your heart, the longest delivery route in your body, your feet. Today, I'm going to walk you through 9 specific warning signs that show up on your feet long before any blood test catches the problem. Some of these you've probably had for months. Some of them you may have written off as just getting older. Stay with me through all 9, because sign number 5 is the one almost nobody connects to diabetes. And sign number 9 is the easiest to see, sitting in plain view every day, and the most overlooked. Let's begin. Sign number 1. Persistent tingling or numbness in your feet. Now, almost everyone has had this at some point. You sit cross-legged for too long, your foot falls asleep, you stand up, and there's that pins and needles feeling. That is normal. What I want you to notice is whether this is happening to you regularly, without a clear reason. Sitting at the breakfast table, lying in bed, walking to the mailbox. If your feet are tingling on their own schedule, your nerves are talking to you. When blood sugar stays too high for too long, the extra glucose acts like a slow acid, eating away at the protective coating that wraps around your nerves. Think of your nerves like an electrical wire. The plastic insulation is what keeps the signal clean. Strip that insulation and the wire still works, but the signals get fuzzy. That fuzziness is exactly what tingling is. The American Diabetes Association estimates that nearly half of people with diabetes will eventually develop this nerve damage, called peripheral neuropathy. And it almost always starts in the feet. My advice: take a 20-minute walk every day if you possibly can. Not a jog, a walk. And start reducing added sugar today, not next month, today. Sign number 2, a burning sensation in the soles of your feet, especially at night. This one is sneaky because it doesn't bother you during the day when you're distracted. It hits you at 11 p.m. when you're lying in bed and the room is quiet. And there's nothing to think about except the heat in the bottoms of your feet. Patients describe it different ways, like they walked across a hot beach, like a slow, dull burn that won't quit. When I hear this from a senior patient, my ears prick up. Because burning feet at night is one of the textbook early signs of diabetic neuropathy. The nerves in your feet have been damaged and now they're misfiring, sending heat signals to your brain even when nothing hot is touching your skin. Think of it like a fire alarm with a broken sensor. The building isn't on fire, but the alarm is screaming because the sensor itself is faulty. A study in the journal Diabetes Care found that this burning pain often shows up 1 to 3 years before a formal diabetes diagnosis. 1 to 3 years. That is how much advance warning your body is giving you. The fix here is twofold. Drink at least 8 glasses of plain water every day and add fiber to every meal. Vegetables, oats, beans. Fiber slows how fast sugar gets into your bloodstream, which gives those damaged nerves a chance to breathe. Sign number 3, cuts and small wounds that just won't close. This is where diabetes stops being uncomfortable and starts becoming actively dangerous. Patients walk into the emergency room and say, "Doctor, I had this little blister from my new shoes 3 weeks ago. It's still open. I figured it would heal on its own." And it should have. In a healthy body, a small cut closes in 5 to 7 days. But when blood sugar is consistently high, the tiny blood vessels in your feet stiffen and narrow. The white blood cells and oxygen and nutrients that close wounds simply can't get through fast enough. Imagine trying to water a garden with a kinked hose. The water is there. It's just not reaching the soil. Here is the chilling number from the Centers for Disease Control. Diabetic foot ulcers are the leading cause of non-traumatic leg amputations in the United States. Over 100,000 every single year. And almost every one of those started as a small wound that was ignored. Tonight after your shower, sit down and look at both of your feet carefully. Between the toes, underneath, the heels. If you see any cut, blister, or open spot, clean it gently with soap and water. Apply a basic antibiotic ointment and cover it. And if it isn't getting better within 48 hours, call your doctor. Not next week. 48 hours. Sign number 4. Darkening or discoloration of the skin on your lower legs and feet. This one hides in plain sight. You glance down at your ankles in the shower and notice they look a little darker, a little reddish, almost bruised even when you haven't bumped anything. And you tell yourself, I've always had dark skin around my ankles. Sometimes that's true. But there is a specific pattern of discoloration that doctors are trained to look for, and it has a name: diabetic dermopathy. When the small blood vessels in your lower legs are damaged by sustained high blood sugar, the skin in that area doesn't get enough fresh oxygen. Over time, it changes color. You might see darkening, a reddish stain, even patches that look slightly bluish. The skin may also become thinner, more fragile, easier to bruise. A study in the Journal of the American Academy of Dermatology found that these skin changes are detectable on average 18 months before a formal diabetes diagnosis. 18 months of warning written on your skin. My recommendation: 5 minutes of ankle circles, toe raises, and gentle calf stretches every morning before you put your feet on the floor. Even that small amount of movement helps push fresh blood into your lower legs. Now, before we go further, let me ask you something. Have you noticed even one of these first 4 signs in yourself or in someone you love? If the answer is yes, please type the word yes in the comments below. Just the word yes. I read every single comment on this channel, and I want to know what you're noticing in your own body. And while you're there, please hit the like button. It tells YouTube to show this video to more seniors who need to see it. Sign number 5. Heels that crack and split open and just won't heal no matter how much lotion you use. This is the one that surprises my patients the most. Cracked heels are common in older adults. I understand that. But when your heels are cracking deeply in the middle of July, when your lotion does nothing no matter how much you apply, that is a completely different story. Diabetes attacks a special group of nerves called the autonomic nerves. These are the nerves that control automatic functions you never think about, including the sweat glands in your feet that keep the skin naturally moist from the inside. When those nerves get damaged by high blood sugar, the moisture pump shuts off. No amount of lotion fixes the source. And those cracks in the skin of your feet are not just a cosmetic problem. They are open doors for bacteria. In a foot with poor circulation, a bacterial infection can turn serious in days, not weeks. The American Podiatric Medical Association has identified chronic, treatment-resistant heel cracking as a meaningful indicator of autonomic neuropathy in seniors. Every night before bed, moisturize your feet thoroughly. Every night before bed, moisturize your feet thoroughly. Coconut oil works beautifully, but any good lotion will do. Apply to the soles and heels, but never between the toes. Trapped moisture between the toes invites fungus. And drink your water. Your skin needs hydration from the inside as much as from the outside. Sign number 6. Persistent swelling in your feet and ankles. Some swelling is normal. If you've been on your feet all day at a wedding or you took a long flight, your ankles might puff up a bit. That resolves overnight. What I'm talking about is different. Swelling that's there every evening. Swelling that leaves deep sock marks. Swelling that doesn't go down by morning. When blood sugar damages the kidneys, and diabetes is the leading cause of kidney disease in this country, your body's fluid regulation gets thrown off. Excess fluid pools downward because of gravity and settles in the lowest parts of your body, your ankles and your feet. Press your finger into a swollen ankle, hold for 5 seconds, and let go. If the indentation stays there for several seconds before bouncing back, that is called pitting edema, and it is a real medical sign worth bringing to your doctor's attention. The National Kidney Foundation reports that diabetic kidney disease affects roughly 1 in 3 adults with diabetes, and lower leg swelling is often the very first visible signal that kidney function is starting to slip. The advice here is simple. Elevate your feet for 15 minutes a few times throughout the day, especially in the evening. Even a few inches on a pillow is enough to help drain fluid back toward your heart. And read the sodium labels on what you eat. Salt makes your body retain water, and most processed foods are loaded with it. Sign number 7. Sharp, stabbing, or electric shock-like pain in your feet, particularly at night. This is the one I see misdiagnosed more than any other. Men especially come in and tell me, Doc, I've been taking ibuprofen for foot pain for 6 months. I figured it was arthritis or an old injury, and sometimes that's exactly right. But sometimes the pain has nothing to do with arthritis at all. When nerves are damaged by high blood sugar, they don't always go quiet. Sometimes they go the opposite direction. They become hyperactive. They start firing random, intense pain signals into your brain when nothing is actually wrong. Patients describe it as a stab, a hot needle, an electric shock that comes out of nowhere. It happens most at night when you're lying still. Ibuprofen and other over-the-counter pain pills will mask this for a few hours, but they don't fix damaged nerves. And worse, Taking ibuprofen daily over the long term has its own dangers. It raises your blood pressure, it hurts your kidneys, and as a heart surgeon, I'll tell you plainly, it increases your heart attack risk. A study in the New England Journal of Medicine found that this kind of painful diabetic neuropathy affects about a quarter of people with diabetes and is frequently mistaken for arthritis for years before anyone tests blood sugar. Every morning before you stand up, do 5 minutes of gentle foot stretches in bed. Flex your feet up and down. Circle your ankles. Pull your toes back gently. Get circulation moving before you put weight on your feet. Sign number 8. Cold feet that stay cold no matter what. We all have feet that get cold sometimes. Cold floors, cold winters. That's life. What I want you to notice is whether your feet are cold in July, cold under 3 blankets, cold while the rest of your body feels warm. That changes the picture completely. As a heart surgeon, this is the sign that lights up my brain like a flare. Because persistently cold feet that don't warm up are one of the cleanest signs of peripheral artery disease. Your blood vessels have narrowed, often because of long-term high blood sugar, and warm blood simply isn't reaching the ends of your feet in sufficient volume. Picture your circulation like a heating system in a large house. When the pipes narrow, the radiator in the back bedroom stays cold no matter how hard the furnace works. The American Heart Association estimates that more than 8 million Americans have peripheral artery disease, and diabetes is the single largest risk factor for it. Cold, pale feet are one of its earliest signs. The single best thing you can do here is a brisk 30-minute walk every day. Not a stroll. Arms swinging. Pace up. If 30 minutes is too much, start with 10. The point is to force your blood to push into your lower legs, strengthen the vessel walls, and over time even partially reverse some of the early narrowing. And finally, sign number 9. This is the one almost nobody talks about. I have never once heard a patient bring this one up themselves. It's only when I look at their lower legs during an exam that I notice it. And then they look down and say, huh? I never noticed that before. Look at the skin on your lower legs and the tops of your feet. Compare it to the hair on your thighs. Is the lower leg hair significantly thinner or completely gone? Hair follicles are tiny, but they are demanding. They need a steady supply of blood and oxygen to keep growing. When circulation to your lower legs has been compromised by years of high blood sugar, the follicles slowly stop receiving what they need, and the hair stops growing. The absence of hair on your lower legs is a quiet, visible marker of blood vessel damage that has been happening underneath the skin for years. Published research in the journal Diabetes, Obesity, and Metabolism has confirmed that hair loss on the lower extremities correlates strongly with peripheral vascular disease in diabetics. It is a reliable physical sign that vascular doctors are specifically trained to check for. Right after this video, look down at your lower legs and feet. If the hair is significantly thinner or absent, please schedule a simple fasting glucose blood test this week, not this month, this week. It costs about $12 at any standard lab, and it is covered by Medicare for most of you. $12 and one blood draw can change the entire trajectory of your health. It costs about $12 at any standard lab, and it is covered by Medicare for most of you. $12 and one blood draw can change the entire trajectory of your health. So let me bring all of this together. 9 signs your feet are giving you. Tingling and numbness. Burning at night, cuts that won't heal, skin discoloration on your lower legs, heels that crack no matter what, persistent swelling, sharp stabbing nighttime pain, cold feet that won't warm up, and hair loss on your lower legs. Each one of these is your body's early warning system, asking for help, often years before any blood test would catch the problem. Here's what I want you to do tonight. Just one thing. Sit down somewhere with good light, take off your socks, and look at both of your feet for 30 seconds. Look between the toes. Look at the heels. Run a fingertip along the skin and check for numbness. Examine the color of your ankles. If you see or feel even one of the 9 signs we just covered, please call your doctor tomorrow morning and ask for a fasting glucose and a hemoglobin A1C blood test. The earlier this is caught, the more completely it can be managed in most cases with a change in diet, daily movement, and a real conversation with your doctor. You have worked too hard for the life you have, your independence, your energy, your ability to do what you love. Don't let a manageable condition like blood sugar take any of it from you, just because nobody told you what to look for. Now you know. If this video helped you, please do 2 things for me. First, share it on Facebook right now and tag one person you love who is over 50, a spouse, a sibling, a neighbor. You might be giving them a piece of information they desperately need.